Or do you want to give people another minute or two?
Yeah, I'd say we gave people enough time. We're about 5 minutes behind schedule, so let's get moving.
All right. We're hoping this will take about an hour. There are 28 slides, but some of them don't need to be covered in detail. So I do have a couple of poll questions to get us going, just to get a feel for who is here and how much familiarity you may have with homeless services or home. It's kind of two things that don't often intermingle that closely. And so as we've been watching the webinars from HUD, there's a lot of questions about what is a COC and what is a PJ. And so making sure that everyone is kind of on the same page and at the same level of familiarity. So our first question is, have you already, about how much do you know about HOME-ARP? Have you read the implementation notice, watched any of the webinars? April, I will try to send that link to Gary. I thought that he was registered. Okay. Okay, so we've got 33 people who have responded. It looks like most of you have not read the implementation notice or watched the HUD-sponsored webinars. That is fine. Good to go. And then the next one we have is, who are you? Are you a service provider, a nonprofit housing provider, a different kind of housing provider, and then just someone who's interested? Okay, so we've got 27 people, 28 people who've responded, and it looks like we have a really good mix of housing providers, service providers, landlords, and even a few just interested residents. If you all would like to see, that's our mix. Okay, so HOME-ARP is some funding that we are receiving. The closed captions are interfering with my, there we go. Okay. I hope you all can see the closed captions and that they work well. This is a feature that I've never used before. So HOME-ARP came as part of the American Rescue Plan that was passed back in March. I could be wrong on that, but it was passed earlier this year, and it included $5 billion allocated for homeless assistance and other at-risk households. And that is coming in this form of HOME-ARP. It was distributed along the regular home formula. So if you are a community that regularly receives entitlement funds, so for HUD, that's ESG, CDWG, and home funds, which we receive every year, then you were also going to have access to these HOME-ARP funds. These funds are available for a longer period of time than your regular home funds, so we can use these funds through September of 2030. And then the program requirements were established in HUD CPD Notice 2110, and that was published in September. So there's a link to that at the end of this presentation and in the slides that I sent everyone. If you did not receive the slides from me this morning, please let me know and I'll send them to you. HOME-ARP is home, but it's not home. So there's a few differences that we wanted to note at the beginning. which is that there is no matching requirement as there is with regular home funds. There's no CHODO set aside. Typically, we have to set aside 15% for a community housing development organization. We don't have to do that with these funds. And there's no maximum per unit subsidy limit. There's a minimum of $1,000 per unit that is constructed or rehabilitated, but it's pretty easy to meet $1,000, so we're not worried about it. And then finally, the compliance period does not depend on the amount of assistance in the project. In regular home funds, if that may vary, that your compliance period may be shorter or longer depending on how much money is in it, but here it's a flat amount of time depending on the type of project. We'll have other more specific differences between home and HOME-ARP as we talk about the eligible activities, but for now, those are the overall changes that I wanted to note. Okay. So we are receiving approximately $8.2 million for the Omaha Council Bluffs Consortia. The consortia is typically two cities that are very close together, and we can share funds. Council Bluffs doesn't receive their own ESG funds and they don't receive their own home funds, but they do receive their own CDBG funds. So typically how this works is that when we do our annual action plan, we do our plan for Omaha, Council Bluffs does their plan, they do their own public engagement process, and then we submit them to HUD together. And we think that's how this is going to work as well. Council Bluffs is entitled to up to 10% of the allocation, but we all have to work together to do our prioritizations of who we're going to serve and making sure that it's all best for our community. 5% of the funds can be spent on administrative costs. And so when it comes down to it, Council Bluffs will receive about $700,000 or $800,000, a little around there. And then Omaha will have about $7 million to spend on projects. Before we move on to qualifying populations, does anyone have any questions about the allocations or just the really basic information we started with? I'm just going to give you a beat since this was a short section. Seeing none, I will move on. Okay, qualifying populations. Qualifying populations is a new term in this program, and it's just who these funds are intended to serve. HUD is pretty specific about who it's intended to serve. So we have people who are literally homeless, people who are at risk of homelessness, and people who are fleeing or attempting to flee domestic violence, sexual assault, stalking, or human trafficking, and other populations. We're going to talk about homeless, at risk of homelessness, and other populations more in depth, but the fleeing or attempting to flee domestic violence, sexual assault, stalking, or human trafficking is a fairly straightforward definition. If you have any questions about it, we can go through it. There is a very detailed definition in the notice that you can read and ask more in-depth questions if you like. So the first is at risk of, or is homeless. These come from largely the McKinney-Vento Act definitions, but you can find them at 24 CFR 91.5. One other thing I wanted to note is that in the HUD webinars, they've made it fairly clear that while we can serve any of these qualifying populations with projects, that Congress did order them in the way that they think we should most serve. So it's definitely going to, who we prioritize will definitely be based on local data and input from our service providers and people with lived experience, but that is just something to note and keep in mind as we go along. So people who are literally homeless are defined as individuals or families lacking a fixed, regular, or adequate nighttime residence, or who will immediately lose their primary nighttime residence. So that is within 14 days. So that basically means if someone has an eviction notice, There can be other qualifiers, and then there's unaccompanied youth. I'm going to go through these definitions fairly quickly so that we can get into meat. At risk of homelessness is a much more detailed definition because it has these other criteria related to unstable housing. I have a link to these definitions on the last page, so you can go and read them there. But at risk of homelessness is basically you're lacking income, you're lacking supports to help you address your situation, and you're in an unstable housing situation. Other populations. So this first definition is, it seems, mostly people who are already housed because they are part of a housing program. So that could be a rapid rehousing program. It could be that they're receiving the ERAP funds, the emergency rental assistance, and that is why they're able to maintain their housing. And then also households at greatest risk of housing instability. Again, that's further defined in the notice, but it particularly calls out veterans and families that include a veteran family member. And a lot of these terms will use area median income, particularly at risk of homelessness. So I wanted to include this chart just so that if you go and read those definitions, you can have this easily accessible to understand what income ranges we're looking at. Okay, do you have any questions about population before we go on? Courtney, thank you for getting that question. Oh. What's that one? Yeah, I can make you a host. Yeah. Okay, one thing. Our quiet tool is our favorite helper, and he's so much more than that, but he is going to help us. Okay. Okay. I don't see any questions on qualifying populations. So, are non-US citizens eligible? So that's a really good question, Brandon. A lot of the HUD funds don't restrict eligibility to US citizens, but the state of Nebraska does have rules against providing assistance to people who are not US citizens. So I don't know, that's something we'll have to suss out because I don't know how that would affect Council Bluffs receiving funds that come through the state of Nebraska. So we'll look into that one.
Nicole, I believe that home funds, in general, you are not eligible to use for persons that are not of legal status. You have to be a lawful US resident.
Okay.
So unless there are very few programs that allow for that exemption, the lead program is an example, but the guidance so far does not call out whether or not you have to be a lawful permanent resident. I would say for Council Bluffs, we would require we would use the home rules, which would require the lawful permanent resident.
Okay. Thank you, Courtney. Stacy. I think, Stacy, that yes, it would include people who are getting private housing assistance, and yes, it will exclude homeowners because they're not considered literally homeless. If there's like a repossession, that might be something we have to clarify with HUD. Courtney, do you have any input there? And Wyatt has a question for me.
I do not. I'm not sure that I believe that it actually excludes homeowner. It has to be TBRA, the tenant-based rental. So I do not believe there's dollars for homeowners.
But I'm not sure how it would, it really, it could depend on the program though. If like with support services, if it includes homeowners or not. So Stacy, that is a complicated question, and maybe we can talk about it more when we talk about the eligible activities. Does that make sense? Okay. Don't see any more questions, so we will go on to eligible activities. There are 4 primary eligible activities in the HOME-ARP notice. That is acquisition, construction, or rehabilitation of rental housing, tenant-based rental assistance, supportive services, and acquisition, construction, or rehabilitation of non-congregate shelter. One big thing that we've seen asked about a lot is if HOME-ARP funds can be used for traditional emergency shelter. They cannot. They cannot build, they cannot pay rehab, they cannot pay operating costs. You can't do it. It's not even up to us. It's pretty clearly called out. Even for non-congregate shelter, you can't pay operating expenses. You can only acquire, construct, and rehab, and then you could pair that with another program for supportive services. But we'll go into each. So we talked about what qualified populations are. And so QP is qualified populations from here on out. And that will come up in just a minute. Okay, Stacy says we have so few options for homeowners experiencing risk of homelessness due to foreclosure and forbearance. Yeah, I don't think these are the funds that are going to solve that gap, but we can talk about it as a community. And I don't have a better answer than that right now. So the first activity is rental housing. We talked about the eligible activities for that: acquisition, construction, rehabilitation. Eligible costs are fairly similar to regular home funds. However, there is an allowable expense of operating cost assistance or reserves. HUD recognizes that doing a very low income project is going to be difficult financially without having some additional supports there. So the operating cost assistance or reserves can be put into the budget to help with the expenses of operating these programs that are rental housing. It's much more detailed in the notice how those operate, and I don't want to get details wrong here. So if you have questions about how that works, let's go through it together and look at it after this meeting. In rental housing that's operated with HOME-ARP, at least 70% of A projects, not the total units that you do, A projects units must be qualified population households. So if you have a unit or have a project that has 10 units in it, you could rent 7 of those units to qualified populations that are referred through coordinated entry, and then you could have 3 of those units that are rented out to people who are at low income levels. So that's 80% and below. That's again to help with the financial feasibility of these projects. And then all rental housing will have a 15-year compliance period. So for 15 years, these units can only be rented to qualified populations and low income units. And you have to do an annual reevaluation of each of those tenants. You're not alone with it in these rental housing projects. One of the things we really want to see are good partnerships. So don't take this as if you develop rental housing, you're on your own in housing people that may have significant barriers. We'll talk about it more with supportive services. So some of the things that are the same versus what's different with home versus HOME-ARP. If you have worked with home before, you're probably used to the maximum rent levels. You're probably used to occupancy requirements based on income levels. You are probably used to Davis-Bacon if you do a large enough project. So all of those things still apply with HOME-ARP, but there are a few different things that we've kind of already talked about a bit. So tenant rent contribution limits. For these projects, the tenants cannot pay more than 30% of their household income. So this is one of the ways that partnerships become really important. If you have someone who is, as long as they are at 50% of the income, of the area median income and below. So if you have a project that has these units in it, you can just take people off of the coordinated entry list. And as long as your rents are at 30% or below of their income, then you're good. Or you can partner with a service provider who does rapid rehousing, or someone else who maybe you put in for supportive services. Okay. If you partner with someone who's doing supportive services and TBRA, then those residents can come in and the TBRA will pay their rent with, and the service provider partner will manage their contribution. That's part of the it can be part of the master leases there that you see. Master leases are when a nonprofit provider partner has the lease to the units and they manage who's living there and they sublease with the tenant. That allows for a stability for that partner in having a unit to rent to people who are being referred to them. And it takes some work out of the landlord or property owner's day. And then there's the 15-year compliance period, which is different from regular home. What questions do you have about the rental housing? Okay, I don't see anything yet, so we'll go on and we can talk about how these eligible activities will interact as we go. So the next category is tenant-based rental assistance. This is similar to the tenant-based rental assistance that operates through the home program now. The city of Omaha has a TBRA program with the Omaha Housing Authority. This tenant-based rental assistance, any potential tenant-based rental assistance here does not have to go through OHA. It could go through another partner, and it could be paired with a rental housing project or with, it doesn't have to be, but it could be. So tenant-based rental assistance is a rental subsidy that is tied to a household. It's not tied to a unit. So that tenant can go and live wherever they so choose. TBRA from HOME-ARP can be tied to a project or can be used at a project-based program, but it's up to the tenant to make that choice that they want to live there. Eligible expenses include rental assistance, security deposits, and utilities. Sponsors for home TBRA are, again, nonprofit partners. And they would be providing support services as well as the rental assistance. So if you were partnering with a rental housing program, you would have that sponsor would have the master lease with the landlord, and then they would be providing the support services and the rental assistance to those clients. Some other things that are different from the home TBR or the regular home TBRA program is that the 24-month subsidy is waived. the PJ, the participating jurisdiction, so that's the city of Omaha and the city of Council Bluffs, would set the time period that that housing that housing subsidy would be able to continue. I have not seen much guidance so far about what HUD will see as an acceptable time frame. So that does make me a little nervous in trying to give you any guidance on what that could be. The TBRA program through HOME-ARP cannot be used in connection with homebuyer programs, and you'll see that throughout. These funds are not intended to be used with homebuyer. So supportive services can't be used with homebuyer. These funds are here to help house people who are currently experiencing homelessness, get people back on their feet. It's not a homebuyer program. Sue asks, would there be a chance they would make it less than 24 months, making it more difficult? No, they specifically say that it's up to the PJ to set that time frame, and it's intended to be longer, I believe, so that we can get people more stable. I think that there's some recognition that these are funds that might house people with higher barriers, and that they may need a longer term subsidy than 2 years. Okay, supportive services. So supportive services can be provided separately or together with the HOME-ARP program. And there are 3 categories of eligible services. So there's McKinney-Vento, homelessness prevention from the ESG program, and then housing counseling. Housing counseling will have to be provided by someone who is qualified through the, I'm sorry, I just forgot the term. HUD has a qualifying test, and you do have to go through that and pass those tests to be able to provide housing counseling. So it's different than the housing counseling that can be provided with a rapid rehousing program. The homeless prevention in McKinney-Vento, a lot of us are pretty familiar with, and they're very well described in the notice. But some of the things that those services can do are things like childcare, education services, employment assistance, and job training. They can provide food, housing counseling, search, and counseling services. So yeah, Sharina, HUD housing counselor, that is correct. So with the housing search, that would be looking for a place to rent, not a place to purchase. Outpatient health services, outreach services, substance abuse and treatment services, transportation, case management, credit repair, a landlord-tenant liaison, services for special populations, financial assistance costs, and that can be for short and medium-term rental assistance. So even if we weren't doing a TBRA program, there's a chance that we could do that short and medium-term rental assistance. One of the things that I've seen a lot recently with people emailing me to ask about are services for people who may be doubled up. So they don't qualify as literally homeless because they are staying in a home, even if it's with friends and families. They may not necessarily be, they may not qualify as at risk if they're staying with someone for a longer term, but that they need those support services to get into their own housing. It seems like that is a potential use for this type of fund or this type of activity. This type of activity can also be paired with a non-congregate shelter program or with TBRA and with the rental housing. So it's intended to keep people in their housing. And then the last eligible activity is non-congregate emergency shelter. So this is acquisition, construction, rehabilitation, and the costs associated with that. It may not cover operating costs. And again, this is only for non-congregate shelter. These funds cannot be used for traditional emergency shelter. Non-congregate shelter does have some minimum use periods as well. So if you are doing new construction, that's 15 years. And if you're rehabbing or only acquiring, sorry about that, it's NCS for 10 years. That's must, not most. If you want to do some non-congregate shelter temporarily, like say through COVID, if you only acquire a building, you can convert it to permanent housing after 3 years. If you do a moderate rehab, after 5 years, you can convert it. And then if you do a substantial rehab or new construction, you can convert it to permanent housing after 10 years. This is a page with a lot of typos. What questions do you have about the eligible activities before we go on to look at some data from our COC? Okay, I don't see anything. Keep putting them in the chat as we go, and we'll get to them.
Nicole,
Yes, Courtney.
There is a question about pairing with supportive services.
Oh, I'm so sorry that I missed it. What was that question? Why is this not letting me scroll up? Courtney, can you tell me what the question is? Because it said,
would operating costs be included if paired with supportive services?
Operating costs for a rental program or for non-congregate shelter?
Naomi, which are you asking for?
Oh, Naomi is asking for non-congregate shelter.
Okay.
No, operating costs still wouldn't be able to be covered. So operating costs would be things like the security and the utilities, but it could cover things like food and case management. Those would be supportive services. And I don't know why my screen is not letting me see. My screen's not letting me see the chat now. So Courtney, if someone pops in with a question, or Wyatt, will you please just let me know? Wyatt, I can kind of hear you, but not really. Oh, okay, very good. Okay, so a lot of our data here will be from the point in time count, PIT, and the housing inventory count, the HIC, from mostly from this year, but also going back a few years so we can look at some trends. So the first is our point in time count of people who are currently experiencing homelessness. This counts people who are in emergency shelter, people who are unsheltered, people in transitional housing, and people in safe haven. So you can see that our numbers have been pretty steady. The point in time count, sorry, before I move on, the point in time count takes place on the 4th, in the last week of January. And it's the night that we count how many people are in each of these places. And we also take a look at how many beds are available in our permanent housing programs. So it's just a very quick snapshot of that one night. So this year, we had a decrease by a couple hundred people.
I'm sorry, Nicole, I'm going to interrupt you. Your screen has not changed. You're still on the some quick data.
Well, that's not great.
There you go.
Okay. Okay. So I don't know why it's giving me a hard time, but it is. So we had a decline in the number of people who were experiencing homelessness on that fourth week of January this year. But we do have some complicating data with that we want to keep in mind to give it context. So keep in mind that there was an eviction moratorium in place. We had stimulus checks still impacting people's budgets. And then in January, our shelters were still doing a lot more social distancing, accepting fewer people. And we also have people who didn't want to go into shelter because of COVID. This night in January was the very first night that our non-congregate shelter program started. And so there was one family in non-congregate shelter that night. And then when we look at that number of 94 people unsheltered, you can see that it's an increase from past years already. But at this point in time, we have more than 300 people enrolled in our street outreach programs across the Omaha, Council Bluffs, Sarpy County areas. And most of that's in Omaha and Council Bluffs. So we've seen huge increases in the number of unsheltered people in Omaha and Council Bluffs. And our street outreach team is out. I say our community street outreach teams, which are primarily through Community Alliance, Sienna Francis House, Together, and Heartland Family Service. They're out every day making contact with people, providing necessary supplies, and they've been able to expand a lot due to the ESGCV funding that they were awarded. So hopefully we can keep that going once the ESGCV funds expire in September of next year. So that same night on the permanent housing side, we had 456 beds available in rapid rehousing programs, 170 in other permanent housing. Other permanent housing is primarily Open Doors permanent supportive housing program because it's not a traditional permanent supportive housing program. And it also includes the Salvation Army's VA grant and their per diem programs because that's where HUD says they should be. I don't have any better reasoning than that. And then we had 782 people in permanent supportive housing programs across the community, which means, you know, that we had about 1,400 people in permanent supportive housing and 1,200 people currently experiencing homelessness. And that doesn't tell us anything about who was doubled up. Another thing that we want to look at is where we have inequities in our system. And so we can look at who is experiencing homelessness on this night. Oh, I'm still a slide behind.
Yes.
Did it change?
No.
I'm so sorry. Now?
No, it might be better just to end your presentation and just scroll through,
Yeah.
unfortunately.
You know what? I'm gonna have to, I think, just exit Zoom and come right back, which is not ideal. But I can't see anything now. Okay. I'm gonna close out my Zoom. We'll be right back. I really hope that you all are here when I return. I'm so sorry for these interruptions. Okay, Wyatt is a co-host, so it shouldn't end. Wyatt, am I out?
No, you're still there.
Great.
Nicole, I can share the presentation if you just want to stay on there.
Yeah, Courtney, that would be great.
Are we in the right spot?
I can't see anything. Racial demographics, perfect. So we can see that the two biggest disparities we have between who is experiencing homelessness and our Omaha population. And Courtney, I'm sorry, I was having difficulties with the census data.census.gov, so I only have Omaha. We see that Black African American folks have a huge disparity between their portion of the Omaha population and the portion of people experiencing homelessness. And we also have a very significant disparity for Native and Indigenous people. So racial equity has been something that the COC has been working on. If you don't know the term COC, that's Continuum of Care, and that's matched the Metropolitan Area Continuum for the Homeless, which is kind of the umbrella organization for all of our service providers. And it's also a big focus of HUD. So we want to make sure that we're keeping racial equity in mind as we move any projects forward, and that we're serving people equitably. And then Courtney, if you'd like to move forward again.
Yep, you're good.
Okay, thank you. So this is just a few things to call out from the 2021 PIT, is that we had 8 people identified with HIV/AIDS experiencing homelessness, 288 people who are chronically homeless, which is determined by length of chronicity, how long they've been homeless, how many times they've been homeless, particularly over the last 3 years we look at. 73 youth, ages 18 to 24, 12 to 24. I'm sorry, I don't have the ages correct in my mind. 86 people who were identified as fleeing domestic violence, 425 people with mental illness, 332 people with substance abuse issues, and 104 veterans. If you'd like to move forward again, Courtney, if you have any questions about that data, now is the time to put it in the chat. And again, Courtney, you're going to have to tell me, or Wyatt, you're going to have to tell me if anyone is leaving us comments.
Does not appear we have any questions.
Okay, thank you. All right, so we'll move on to what the process for HOME-ARP looks like. Are we good on the process diagram?
Yes.
Okay, thank you. So the first part of the HOME-ARP process is consultation. And this is, to my heart, the most important part of doing this project. These funds, this amount of money is not something we typically see come through federal systems to get to serving people experiencing homelessness. So we have a chance here to do some really cool projects if we're intentional and if we do some good listening. So while we're not necessarily listening as much in this presentation, we will be doing that starting with on November 19th. I will be at the general membership meeting for Match. And then in December, we'll be at Provider Council, and we will also be working on contacting OHA, landlords, developers. If you would like to participate, we'd love to have you. And just reach out to me and I will find a time to include you. And then the last question is, who are we missing? Who do you think we really need to talk to that's not mentioned there? And if you put it in the chat, I can't see it. So if you could email me, or if Wyatt and Courtney, you can take some notes on it, I would much appreciate it. So after we do our consultation, there's a timeline on the next slide that we can go through. After we do consultation and during, we'll start working on our allocation plan, which is the document that we are required to submit to HUD as a substantial amendment to our 2021 action plan. And that describes what our process of consultation looked like, who we talked to, what feedback we got, and then it will describe how we prioritize the eligible activities, what eligible activities we do or don't intend to undertake, and whatever preferences we've established for what qualified populations will be served. So are we within the qualified populations? You can say this is a project that's intended to serve veterans. Now, fair housing rules apply. You cannot discriminate based on protected classes. So you cannot say this project will only serve men, or this project will only serve people from, you can't say it will only serve people from the United States. You can't say, we're only going to serve people 35 to 45. So in that allocation plan, that's where we'll talk about all of those things. Once we finish the allocation plan, we'll go into our public participation beyond the consultation. So we'll have a public meeting. We'll have a 15-day public comment period where anyone can give comment on our proposed plan. And what has to be in there at a minimum is the amount of HOME-ARP funds that the PJ is receiving and the range of activities that we plan to undertake. We will provide the whole allocation plan document that can be commented on. But one of the things you might note is not in there is what projects specifically we will be undertaking at that time. That doesn't have to be included in the home allocation plan. After we have the allocation plan approved by HUD, which is a process that can take up to 45 days, then we will be able to put out our request for proposals. And we'll make sure that all of the requests for proposals make sense with what we're doing. Some of the things that this will require is the feasibility. So this is going to be much more similar to a regular home application and a regular development application than it will be to our typical ESG application. So be ready for that. And again, one of the things we really want to see is partnerships and some intentional, really cool ways to serve the people that we're all here for. So if you want to go to the timeline slide, Courtney. Thank you. Okay, so what I'm anticipating, and this could change, is that we'll work on consultation between now and January of 2022. So again, we have that November 19th match general membership meeting and the December 2nd match provider council. I'm working on setting up focus groups with people with lived experience. And I would really like to set up a developer and landlord focus group so that we can talk about what your barriers are to housing folks, what it would take, what assistance you need. So if you are a landlord or developer who is interested in these funds, please reach out as soon as you can. Then we'll look at doing the public participation in the January to March timeframe. So that'll include our public meeting and our comment period. And then we'll have to submit to HUD in spring of 2022. And again, they have 45 days to approve our plan. If they don't approve or disapprove of our plan within those 45 days, it's assumed to be accepted. And then we'll put out our request for proposals. We're thinking in spring, summer of this year. And I'll let Courtney give her time for that in a second, but we want to have projects chosen by the end of 2022. So again, that's a really long time frame for that RFP, but it's because of the way that these funds are set up and the things that you have to have in place, because reallocating the funds once you allocate them to a project is not as simple as it might be with the regular home funds. So we need to make sure that everything's on really sure footing. We want to have our plan into HUD so that if you are an IFA, if you're looking to work in Council Bluffs, that there is that IFA, Courtney, I'm sorry, is that the correct?
Low-income housing tax credits through Iowa Finance Authority.
There we go. We want to be able to get you in there. So, Courtney, would you like to talk about your RFP plan at all?
Sure. So our process, since we are part of the consortia, we are a junior partner. We will still be included in the Omaha plan, just as Nicole's outlined. But if you are interested in a project on the Iowa side, don't contact Omaha, contact me or the community development department. and we'll put some email addresses in there for folks to reach out to with questions. So our timeline, applications to IFA for LIHTC are typically due in the early spring. So we don't want folks to miss this year if we think that we have a good solid application that could be funded and partner with these funds. So I suggest that we start chatting now. And then once our plan is approved by HUD for the consortia, maybe we're able to move a little bit faster. So let's talk as soon as possible is what I would say, so that we can start making sure that you're eligible for any other dollars that you might be wanting to apply for.
Yeah, and if you are interested in this, start talking to us now as well too. You know, I think we learned a lot of lessons with the ESGCV funds, with a lot of money coming in very quickly. And so with lessons learned there, start talking to us sooner than later. You want to go to the next slide, Courtney? Okay, hopefully that is good. So this is just some further reading. If you want to read up on HOME-ARP by yourself, there's a link to the notice in there. There's a link, I think, to the webinars that Home has had going already. And those, there are 4 webinars. You probably won't be too interested in the last one because it's mostly related to what we have to do on our end. And then a link to some of those definitions that are important. And then last slide. So if you have questions or comments, you can reach out to me, you can reach out to Courtney. And if you have anything right now, put it in the chat, and Courtney, just if you see anything and want me to answer it, let me know.
Nothing so far.
Okay, we'll give you a second. And I'm really hoping that since I started this webinar, it will have recorded properly and we can end it. That would be good. Because I can't I can't do much of anything right now. And if it's recorded properly, then we'll get it up on the YouTube page and on the on our website. And I'll send out that link and I'll put it on our Facebook page. Please feel free to share it far and wide. We're really interested in getting some cool projects. Any questions?
Yes, as Nicole said, we will share the presentation. If you registered, we'll send it out.
Yeah, and everyone should have gotten the slides in their email this morning. Nothing further?
Nothing else.
All right, well then you all can go and I will try to end this presentation. And I hope you have an excellent day. You'll be hearing from us and we hope to hear from you. Wyatt, were you able to end the presentation?
No, you're still in here, Nicole.
Oh, can you end it? I can't see anything.